Camera 2 is rolling.
Okay, well, that's the first question I'd like to ask you, how you get into this.
Well, I started as a cardiologist, and I went into cardiology because I really liked doing things with my hands, and I liked technology, but I also liked the people part of medicine, so I didn't want to go into surgery. And I remember when I was in medical school, the first time I saw one of my professors put a catheter, a small tube, inside a vein of a patient, and I was amazed, and I sort of fell in love with the idea of working inside blood vessels. So that's how it came to be. I was a cardiologist, and I did angioplasties and stents and all that stuff. And then
cut. I'm sorry, 1 second. Cut. I'm gonna go in for a tighter shot, and if you could just do that again, that was wonderful.
do that again.
Yeah, I know. This is kind
Take 56.
This is kind of the deal.
Right.
You thought you liked photography, bless her. Please.
You know the drill.
So, why did I go into cardiology? When I was in medical school, I recognized very quickly that I loved doing things with my hands. I loved technology. And I remember seeing for the first time one of the doctors, one of my faculty, putting a catheter, like a little tube, inside a blood vessel on a patient, and I was fascinated by that. And I always was interested in putting things into blood vessels, and it was just something really interesting to me, and I liked it. So cardiology was a really great match for me. I didn't want to do surgery because I really liked the people part and the intellectual part of medicine. So that's why I ended up in cardiology. I did that for many years, and got pretty good at it. And then in the late 1990s, I made a connection with a pretty famous guy in Boston at a meeting, and it got me moving in towards, got me trained. Met this really great, met a very well-known doctor in Boston who was very involved in doing.
I'm sorry, if you could just, I'm sorry, you need to take that from the top.
Okay.
So thank you.
Okay.
From the very top?
Do it from the very top. Do it from the very top. I'm going to start this camera rolling again. It's one of the drawbacks of being camera and sound. Sorry. So, take it from the very top if you would, please.
So why the hell did you get into this fakakta business in the first place?
I have no flipping idea. I should have gone into acting like John Travolta.
That's...
So why did I go into cardiology? I found out pretty quickly when I was in medical school that I really liked doing things with my hands, and I loved technology. And the first time that I saw someone put a catheter in a blood vessel, I was fascinated with the idea of working inside blood vessels. And cardiology was a perfect fit. Cardiology was a perfect fit. I didn't want to do surgery because I liked the people part. I didn't want all my patients asleep. And I liked the intellectual part of medicine. So that's why I ended up in cardiology. So I did that for many years, interventional cardiology. And then about 15 years into my practice, I met a very well-known cardiologist in Boston who was very active in doing treatments, angioplasties, and stents, and those sorts of things. It's the kind of stuff that I was doing in the heart. He was doing it in the arteries of the leg, arteries of the brain, arteries of the kidney, other arteries in the body. And I was fascinated by that opportunity to expand from just the heart to the entire body. So I did that for about 10 years in addition to my cardiology. And in that field I got pretty nationally known because I was pretty advanced. It was a pretty new field and there was a lot of potential for innovation. People would come visit me. In fact, as a result of that, I was recruited by New York University Medical Center to join their faculty and start their program for critical limb ischemia, which is poor circulation in the legs. And so I was on the faculty there for a while. And so I did those two things for quite some time. And then in the around 2004, the technology in vein disease was rapidly evolving, and new treatments were coming out that were very similar to what I was already doing in cardiology and in the peripheral arterial part of my work. So it was an easy fit, and it was blood vessels. It was just veins instead of arteries. And I never wanted to be bored in practice, and I never wanted to do the same thing for 40 years. And I knew that I had to keep changing to stay stimulated and interested. And that was really important to me, and that's why I went into the peripheral arterial disease work, because I didn't want to just do cardiology for 30 to 40 years. So I started to learn about veins, and I went to a lot of meetings, and I read a lot of books, and I visited a lot of clinics, and had a lot of some hands-on training, and decided to open up this practice, which when it started I was doing cardiology, peripheral arterial disease, and veins all together. And then over the years, the veins part of the practice grew really tremendously, and I ended up phasing out the cardiology and the peripheral arterial disease work. So now I work just in the office, and I only do veins, and I love it.
Great. So why did you choose just to do the veins?
You know, when you do cardiology for 25 or 30 years, interventional cardiology, it can get really exhausting. There are emergencies at 2 o'clock in the morning, you know, when it's 2 degrees outside, and you gotta climb out of your bed and go and treat a heart attack. And that was really fun for a long time, because it was exciting, you know, but it gets old after a while. Hospitals are big, bustling organizations that are very, can be very stressful to work in that environment. You get calls to emergency rooms, a lot of phone calls. All the work that I did in those fields needed x-rays, and so you had to wear lead aprons. So I had to wear 20-pound lead aprons for hours and hours and hours every day, which gets pretty hard on your back and feet and things like that. So, you know, I was looking for both an intellectual change, to learn new techniques, and at the same time to do something that was not only interesting but less physically and mentally stressful.
Part of that answer, or the majority of the answer, is kind of negative.
Yes.
It's like, I didn't like to do this and I didn't like to do that.
Right.
Everyone was heavy.
Well, I wasn't prepared for their question. So
I understand.
Right.
And all I'm saying is perhaps you can rethink that answer and put it in a more positive.
Yeah. Okay. Let's do that again.
Yeah.
Okay.
What was the question again? Why did I?
Why do you get into veins?
Why did I get into veins, or why did I?
I'm just going to
What did you narrow down
All right.
from
Why did I
arteries
do
and
into veins?
cardiology
Okay.
into veins?
Okay. I went into vein treatment because I needed something new. I was the kind of doctor that always looked for new things to learn. I wanted to expand my skills, expand my knowledge, apply what I've learned to different types of conditions, and to treat different kinds of patients in different ways. I never was a person that wanted to just stay still and do the same thing over and over and over again. And that was the nature of my cardiology practice. I was always adding new treatments and new technologies on top of the old ones. I was very aggressive with that. And then I added the peripheral arterial disease. Again, I wanted to expand. I wanted to learn new things. I wanted to develop new things, innovate. And then when vein treatment evolved around that same time, it was an outstanding opportunity for me to continue that growth and move my treatments into the venous space.
Great. Is there that challenge of variety now in veins, or is it just the same thing every day? Do you get to do different things with different people, or is
The real answer, or the
No.
the nice one?
The nice one.
The one that makes you
No,
very...
they're not. No, vein disease is different. Every patient that walks in the door is a different patient. No two are the same. They have different symptoms, different complaints, different goals. Some are young, some are old, some are women, some are men. Some have lots of symptoms, some just want a cosmetic improvement. There's patients who have severe skin damage, they have ulcers on their feet. Some come in with bleeding veins, some come in with bulging veins, some come in with just spiders. We do ultrasounds on these people and they all have different anatomy, and you have to put the patient's goals, the patient's physical findings, and the ultrasound, you put it all together and you put together a treatment plan. So every patient is different.
Cool. That's great. So why does somebody need to see a vein specialist like you?
Stripping and saline.
So could you start that line again?
Vein disease has been a very rapidly changing field over the last 10 years. Prior to that, there was vein stripping and saline injections, which were painful, and vein stripping was a painful surgical procedure, and that was where vein disease was for a long time. So starting about 10 years ago, there were a lot of changes, and those changes have continued at a very rapid pace over the last 10 years. And like any other field, if you dabble in it, you're not going to pick up on all of the nuances and the new techniques and the new technologies and the new guidelines that are developed in any field. And vein disease is no different. And it's like anything else, the more you do of something, the better you're going to get at it. A lot of physicians consider, a lot of physicians combine their vein practices with other types of cosmetic services, like weight loss and Botox and hair removal and hair transplant and liposuction, and, all sorts of things. Because it all falls into sort of this cosmetic thing. Well, vein disease is not always cosmetic. I see lots and lots of patients, probably the majority of my patients, don't come primarily because of cosmetic issues. They come because they have pain, they have swelling, and they have other complications of venous insufficiency. And I focus only on that. And these other clinics will, take care of your veins, and then they'll try to get you to sign up for Botox or get your hair transplanted. So I think that in terms of patients getting a full evaluation and a proper treatment plan, and have their treatments done by somebody that does a lot of those treatments and understands how to do them well, I think that's always going to be in the patient's best interest. And clearly, someone who only does that is going to be better at it.
Cool. Do people ever come in with just spider veins or varicose veins thinking it's a cosmetic issue, and then as you go into do whatever you do to look at it, that you find out that there are other issues involved? So
yes, we every week see patients that come in with cosmetic concerns. They don't like the way their legs look. There may be spider veins, there might be small little bulging varicose veins. Sometimes there's discoloration down by the ankle of the foot that they don't like, little blue veins that fill up down there. And these are cosmetic concerns to them.
I'm sorry, we have to cut here. The light has changed, and we now have a totally different light. The light is striking across.
Do you want to close the blinds?
Yeah. Excellent. Okay. Rolling and
Get your sound on.
sound is no. Record. And rolling. Cameras are rolling, sound is rolling.
okay, let's go back to that question again about people coming in thinking they have cosmetic problems.
We see patients every week that come in with cosmetic concerns. It might just be spider veins. It might be some small little bulging blue veins somewhere on the leg. Oftentimes there's a lot of
I'm going to ask
blue
you if you
veins.
would start that one again, please. I'm just going to reframe you ever so slightly.
You're killing me.
I know.
Is will this answer end up on, and it turns out that it's covered by insurance? Does that go that?
It's a little tricky there because, not necessarily,
Okay.
because if they're not having symptoms, it isn't covered.
Okay,
So I'm not gonna go there.
so they,
But
you'll
you should
find
ask
issues,
that
but they,
question.
okay.
But that's a gray zone,
Mhm.
and basically, if it's a cosmetic concern, even if they have deeper problems, insurance isn't gonna cover it.
Really?
Sometimes though, patients will, on more careful questioning, say, you know, I do have this symptom. That symptom."
Yeah, there's a lot of pain.
Well, I mean, I don't know, some of them may be making it up,
Yeah.
but some of them just haven't noticed it.
Mm-hmm.
And you can ask me that question, because I hear that all the time. Patients,
So you're
after
holding-
their treatments, they say how much better they feel, they didn't even know that they didn't feel well before. So they were having symptoms, didn't know it. I have a great example of that in the artery world, which was really interesting.
Well, when you do this answer, can that lead right into it?
Yeah, I'll try, if I don't believe me.
Yeah.
And leave space between your comments.
Right. We see patients every week who come in with cosmetic issues, just cosmetic issues. We see patients here every week with just cosmetic issues. But we evaluate them to make sure that their issue is just cosmetic and doesn't actually reflect a deeper problem.
Let me go back and start again.
Yes, I can.
And I like it when you talk about the spider veins and the lumps and.
Okay. We see patients here every week with cosmetic concerns. Some of them have spider veins, some of them have little bulging blue veins. A lot of people have veins sort of down by their feet, little blue veins by their ankles that they're concerned about. All of these patients need a vein doctor to evaluate for problems that are deeper than the skin. Lots of these patients have had sclerotherapy for their spider veins, and it did work. And the reason is because the doctor didn't recognize that there was a deeper vein problem that needed to be addressed. So we always look for underlying vein problems in our cosmetic patients. Doesn't necessarily mean they all get an ultrasound, but usually on our physical examination and on questioning, we can tease those patients out, and it helps us to make a proper diagnosis and then give them the best treatment that they can get.
Mhm. And are there times when they come in for cosmetic issues and they realize afterwards that they had actually been experiencing problems and they feel better now?
Yeah, think about how to propose it.
Yeah, obviously, I don't know how to ask it.
Yeah, I'm trying to propose it. Yeah, okay. It's interesting that a lot of patients come with all sorts of varicose vein problems. When they come in, you can see it, they know it's there. And they say they're not really that bothered by it. You know, a little of this, a little of that. And they go through the treatments, and when they get the treatments and the treatments are done, they realize how symptomatic they were before and didn't realize it. They thought they were just getting old, that their legs were getting tired, that they were getting out of shape, because their legs hurt when they stood up and their legs swelled, and they got night cramps and they got itching of their legs. All sorts of things that they didn't put two and two together, that this was related to the veins. And then when it was done, they realized that it really was related. I had a patient who came to see me. She had had night cramps in her calves every night for 7 years, waking her up out of sleep. Young woman, about 40 years old, totally healthy. She had small little veins, and she didn't come to me for the veins, but she had heard that night cramps could be from veins. And we evaluated her, and she had a vein problem. We treated the veins, and her first week back, she said, "This was the first week I slept through the night in 7 years." And it was because somehow she put the pieces together that night cramps can be resulted from, she put the pieces together that night cramps can be caused by vein problems. This is the sort of thing that vein doctors can help patients put together. Many primary care doctors, even cardiologists, I was one, don't really fully understand varicose veins and venous insufficiency. And in most medical practices, they focus on the deep vein thrombosis, the blood clots, the serious things, the life-threatening things that require hospitalization, all of that. But I know before I got involved in this, I'd pull up the pants and see a patient and see all these varicose veins, and I'd sort of pat him on the back and say, okay, I'll see you in 6 months. And it gets ignored. And patients don't know what to do. They think that, well, I don't want to have a stripping. You know, grandma had a stripping, it was terrible. So that's why seeing a vein doctor is so helpful, and seeing somebody who really is committed to evaluating and treating patients with venous disease.
Doesn't everybody do the same treatments, and why, when it comes to the treatment, doesn't matter where you go?
Most vein doctors offer pretty similar treatments. The differences are how those treatments are planned. Most vein doctors do pretty much the same treatments. But there are two things that can be very different. One is some people know how to do it better than others, just because they do it more often. If you're going to get your eye operated on, you want to do it, have someone do it who does 1,000 eyes a year, not someone who does 10 a year. But more importantly, making a recommendation for treatment involves making a decision on the proper sequence of treatment for that patient's specific problem. And if you just apply all your treatments to all patients, a lot of patients are going to get the wrong treatment, or they may get too much treatment, or too little treatment. So the decision is not so much, what's important is not what treatments a doctor offers, but how skilled he is at making decisions on each individual patient as to how to apply those treatments in the best way for each patient. That not only gives the patient the best results, it also helps avoid unnecessary treatments and unnecessary costs.
So you can have, depending on the physician, you can have two people giving the exact same treatment and get different results.
Yes, I mean, some of these treatments are almost artistry.
Time out.
Particularly,
We have to stop. We're getting
too much
light on your face.
from,
Well, from one of the windows. Let's just. Camera one's rolling. Sound is rolling. And camera two is rolling.
Okay.
Take it down.
So could you tell me again why you can get the exact same treatment from two different doctors and get a different result? And bring up the artistry idea.
let's start this. Different doctors can get different results doing pretty much the same treatments on the same patients. And the question is why, I get this question, why is that the case? Why did a patient get a good result with me and didn't get a good result with somebody else in the past? And it's oftentimes the same treatment, but there are differences in the way the treatments are actually performed. Sometimes the sequence of the treatments is different. Sometimes performing the treatments themselves requires a certain level of artistry, and a really fine skill, particularly with respect to sclerotherapy, when you're doing spider veins, the little tiny veins, making decisions and strategies on how you're going to approach a particular patient's set of veins. When you're doing lasers on the...
Oops.
Next time we get a pro.
Does he have the light back on him? Or do we
No,
continue?
actually the lights changed. It's just on his shirt this time. Let's just keep rolling.
Even doing something like a laser ablation, which I do and most vein doctors are going to be skilled. Even something like laser ablations, which I do many of and most vein doctors are going to do also, are oftentimes technically difficult. They're not always straightforward. Sometimes the veins are very small, sometimes the veins aren't so straight, Sometimes they've been previously treated. Sometimes you have to go in different locations. There's a lot of skill that goes into doing a laser ablation consistently. Anybody can do an easy laser ablation. Anyone can do an easy, any vein doctor can do an easy laser ablation and probably get a good result. But the challenge is so many patients have difficult situations. They're afraid of needles. Their vein is too small. The vein goes into spasm. The vein isn't straight. There's all sorts of things technically that I run into every day. And I'm always amazed at how many times my skills using wires and catheters inside blood vessels that I've done for 30 years applies here. And many times I find myself doing cases here and I feel like in the old days. And I'm doing snaking something down a coronary artery. So I think that those skill sets vary. And many doctors who get into this don't have the background of working inside blood vessels. Their background might be doing open surgery, where they make incisions and work on blood vessels or gallbladders or whatever, through an open incision. Many doctors that go into veins started in other fields like dermatology or family practice, gynecology. I mean, there's a lot of different doctors that have the technical skills to get started doing vein work, but they don't bring with them a long history of working inside blood vessels and putting wires and catheters inside blood vessels. So I think the results are going to be different depending on who you see.
When somebody comes here, what's the experience like? What do they come here expecting, and what happens, and just from their point of view?
Our philosophy is to make patients' visits here as convenient, as enjoyable, and as personable as possible. We, right from the front desk, try to allay their fears, keep things very cheerful, and at the same time provide them with all the necessary information that they need on the business end of seeking medical care. And then when they come into the examination room, they're evaluated by...
Can we stop and do this one again? Feels like your energy is dropping off.
Okay.
Just you really engage.
Okay.
Tell me about it.
Okay.
Don't sit back.
Okay. I'm having trouble with this question.
No.
Okay. We strive in this practice to give our patients a very positive experience every time they come here. And that starts with the phone call, when they call to make an appointment or to change an appointment. It continues when they walk in the door and they see my receptionist, who gives them a big smile and knows their name and helps them deal with the business aspects of getting medical care. Dealing with the business aspects of getting medical care. And then when they come back into the office, into an examination room, my staff are friendly, they love their work, they're good at what they do. And we strive to make the examination process easy and relaxed. We provide our patients with a lot of educational materials that we have written ourselves on all the different aspects of vein disease and all the different treatments that we do. Education of our patients is a very big part of what we do, and we believe that it vastly improves the patient experience here because they understand what they're having done. The test...
I'm sorry. That was good. That was very, very good. I have been a little nervous.
Yeah, you get past the front desk and they were coming back
Right,
to...
come back. Part of what we also spend a lot of energy on here is making sure that we respect the patient's times. So we also value our patient's time. And one of the things that we get compliments on all the time is that we run on time. Patient comes in at 9:45 for their appointment, and they're in the room at 9:45, and the treatment starts at 9:50, and they're out the door at 10:20. And they comment, they can't believe that we always run on time. Now, sometimes we get a little delayed, but nobody sits there for hours like people do in other other doctors' offices. So we value our patients' time. What else? When they come in for their treatments, they have been educated. They know what they're having done. We've explained it to them. We've given them our printed educational materials. We have a lot of that information on the website. They come in knowing what they're going to have done. And pretty much they're not nervous. And we continue to, when they come in the room for their procedure or their treatment, we aim to relax them and make them.
Yeah, I think you said, I think where you were going was, they know what to expect. We give them all the information. So when they come in.
Right.
Yeah.
So I got that part,
Yeah.
right? And then when they come in for their treatments, we continue to treat them in a way that helps to allay their anxieties about whatever they're having done. We strive during the treatments to make them as easy for the patient as possible. We take a lot of measures to make the treatments as painless as possible and as quick as possible. Most patients come in, if they haven't had, say, a laser treatment before, they come in and they're nervous. And when we're done, which is usually about 15 or 20 minutes later, their response is universally, "That's it? We're done?" And 5 minutes later, they're dressed, and they're standing at the front desk making their follow-up appointment, and they're driving home or to work. And that's the experience that we want. We want them to be able to, we don't want them to dread coming here. And it takes a lot of work on our part to help make that experience happen for them.
Do you think a lot of people have problems and are afraid to do anything about it? That general sense of, oh God, I'm going to go in there, the doctor's office?
Most people are afraid of going to doctors. It's natural. But people know that they have to go see the doctor if they have a life-threatening condition. They go see the doctor and they get some unpleasant tests or treatments or surgeries or whatever they have done. Vein disease is a little different. People don't typically die from their vein disease. They don't lose their legs from their vein disease. Nothing terrible happens. There are problems that develop. But it can be ignored. And when you combine that with a certain fear of doctors, unfortunately, it causes a lot of people to delay when they wouldn't if they had all the information. Once again, most patients who are unfamiliar with how we treat veins today think that the only treatments are the vein stripping that their mother had, which was terribly traumatic, very painful, several days in the hospital, general anesthesia, or saline injections, which was the old way to do sclerotherapy. Saline, although it sounds like a natural injection, is very painful and it's very toxic. So people in the past had experiences that were really terrible. And if patients knew that not only are the treatments better, but that they can be more complete and more specifically tailored to their specific problem, I think they'd be surprised how easy it is. And so many of them, when they're done, say, I can't believe I waited this long.
What makes your staff different? And I know you like them a lot, and I want to have that come out a lot. Is this a different kind of practice than most practices? Does it feel different? Who are the people who are here and why?
Not a day goes by in my office that I don't get a comment from a patient saying how great my staff are. Every day. And when I tell my staff again that I've heard this, they're used to this. It's not easy to have that. I'm very lucky. I've worked very hard to find the right people. I don't think that working in a doctor's office is something that comes naturally to people. It takes a certain temperament, and it takes a certain degree, or a lot of training. It takes a lot of hard work and dedication. It takes a personality that engages people and relaxes people. And it takes someone that loves what they do. And I'm fortunate to have a staff that does all of that. And I think one of the other things that produces a very positive environment for patient, I think one of the things that vastly improves patients' experience here is that they experience staff that are not only good at what they do, not only enjoy what they do, but you can tell that they like each other, and they get along, and they work together as a team. I'm sure all of us have been to doctor's offices, I have, where you know that the person who's sitting behind the counter doesn't want to be there. And that the assistant who brings you into the room is bored. And that doesn't create a positive experience for the patient. And they won't experience that here.
Cool. That's good. If there was one thing you could tell people about veins that they don't understand and would change the way they approach this whole thing, 'cause just knowing the consciousness that people have about what they think about their veins, what would you tell them to kind of align them more with what's
Well,
healthy?
We covered a lot of that.
Just shoot and see if there's a sound bite, but if there's not, there's
Okay,
not.
well, I'll say some stuff and see what comes out.
Okay.
Okay. I think it's very important for the public, or people out there with vein disease. There's so many of them. There's 20 million of them, or 40 million of them in America. It's extremely common. People live with it, they suffer with it, they don't do anything about it. And I think what they need to learn is that it is a medical condition. It can be cosmetic, but most of the time it's a medical condition. They're having symptoms. It never gets better. It only gets worse. And it's a circulatory problem. And that there are doctors who are trained to take care of this specific problem. And that the treatments are safe and effective and easy and without any downtime. And it's often covered by insurance. A lot of patients think that this is considered cosmetic. And while there are some cosmetic patients that we take care of, most of the patients who have varicose veins and symptoms and those sorts of, and that spectrum of problems, their care is paid for with their insurance.
Well, I've got a question. Why, when I was going through the stuff, you do the laser ablation, and some people do laser and RF.
RF, right.
And why do you just do the laser? You know, if somebody sits there and say, well, the other doctor says I can do this, and you say, I just do laser. What's the clinical reason?
One of the most common causes of varicose veins is leakage of the valves in veins in the leg called the saphenous veins. These are skin veins, but they're large, they're straight veins, they're typically on the inside of the thigh, sometimes they're behind the calf. And those are the culprits, the underlying problem that leads to most patients' varicose veins. And the first step is to close the saphenous veins. This is done, in the old days it was done by surgically stripping it. Now it's a lot easier. We don't remove the vein, we close it. And the way we close it is putting a catheter into the vein and we heat it. And the heating basically seals the vein shut. If it's closed, it can't do you any harm because it's been flowing the wrong direction and now it's closed. There are two different ways to close a vein. They both basically put a catheter in the vein and they both heat the vein. One uses laser to heat the vein and one uses radiofrequency energy. Different ways to heat the vein. They both heat the vein. There really isn't much difference between the two. the results between laser and what's called RF, or a closure, which is the radio frequency one, the results are identical. I use the laser only because it's faster than the RF in terms of procedure time. It can be done with a smaller puncture and a smaller tube in the vein, so it's a little less traumatic. And once again, I think that the more you do of something, the better you get at it. If the results are the same in treatment A and treatment B, and you do both, you'll be half as good at each. If you do only one, you'll become really good at it. Our results are as good as RF patients. We get our patients off the table faster and with a smaller puncture.
That's interesting. I'm wondering if we can get to it quicker, that, you know, there are these two ways of doing it,
Okay.
and they do the same thing. I prefer this way.
Okay.
And I specialize in
work
it.
my way up to it. So,
I
yeah,
specialize in it because it's faster. They don't have to. Doesn't take them as long. It's less, you know, traumatic, and you know they do the same thing, and this does it better, I believe. And I specialize in this. And
Right. It doesn't do it better. I think. I mean, the results are the same. Now it is cheaper,
oh,
so
okay.
there may be less out of pocket for the patient.
Let's add that to it. Yeah.
Yeah.
Because I think that's thoughtful. Because that was one of the questions, you know, I
Yeah.
had when I was looking at it. I go, why don't you do it? And if the, I mean, you're doing it because it has benefits for the patients.
Yeah. Okay. Let me put something together. There are two different technologies that are used to close the saphenous veins. Both of them provide heat to the inside of the vein and close it. One treatment is endovenous laser ablation, which is what I do. And the other potential treatment is called RF, or radio frequency ablation. Sometimes it's called closure. Different names for different catheters. Both of these do the same thing. They heat the veins, they close the veins, and the results are the same. I choose a laser because it's faster. My patients get off the table quicker. It can be done through a smaller puncture, so they don't have to put as big a tube in the vein, so it's a little less traumatic. It's cheaper technology than the RF, which probably translates into a lower out-of-pocket for my patients. And finally, I think that the more you do of something, the better you get at it. So why offer two treatments and be half as good? We do the best treatment there is, and we only do that, and we're good at it.
I love that. I think that was cool. Okay. What happens if you don't treat varicose veins?
A lot of patients ask me, what happens if I don't treat this? In fact, I tell patients this before I even talk to them about the treatments. I say, you can leave this alone. It's not like a brain tumor.
I'm sorry, you gotta start that again, because you're not saying what it is. They ask about this. Patients come in and ask about varicose veins. You just need to give context to that sentence, depending on what we
what
put
we're
it
talking
in.
about. All right, okay, I got it. All right.
Okay.
Okay, right, got it. Patients ask me frequently, what happens if I don't take care of my veins? And I tell them, you don't have to take care of them. You can just live with them. They'll never get better. They will almost for sure get worse over the years. And as they get worse, complications can and do develop. The most serious complications is skin damage, which can result in discoloration of the skin, usually around the ankle. It can lead to a leathery thickening of the skin. We call that lipodermatosclerosis. And it's like a leathery change. And that's irreversible. The discoloration, the brown discoloration, is irreversible. In advanced stages, this skin damage can result in ulcers, usually down by the ankle. Patients who get these ulcers can suffer with these ulcers for years without healing. They have to dress it every day. Sometimes they heal, and they almost always come back.
I'm sorry, there's just so much traffic noise for that moment there.
Yeah, okay.
So please just, if you
Do you
do
want me to
that.
redirect the traffic?
That'd be
Can
great.
you do that?
We're
Just
talking about,
take-
so...
Actually, and I liked it when you began with, it's not brain surgery.
Right.
You know, that you're gonna survive, you know, it's not gonna kill you.
Right.
I think that's just a real disarming.
Good, okay,
Exactly.
I'll keep it.
Good.
Patients ask me all the time, what happens if I don't treat this? And I tell them, you don't have to treat this. You can live with it, suffer with it, look at it. It's never going to get better. It will gradually get worse. I tell them they're not going to die from it. It's not like they have a brain tumor and they need brain surgery. But it will get worse. Complications can and do develop. Sometimes they're serious. I've seen many times the veins on this leg, they rupture and they bleed. And patients are terrified of this. Skin damage can occur. You can get a unsightly brown discoloration, usually of the ankle and the calf. Sometimes the skin gets thick and gets kind of leathery. We call that lipodermatosclerosis. These are irreversible changes. And patients who come to me want to get their veins treated, and then they say, well, what about all of that? And I say, well, that's there. It's there because you had veins for 20 years. That wasn't treated.
What is going on up there?
They're cleaning probably.
Ah,
So let me tell them to go away.
please.
What if I don't do anything?
Camera A's rolling. Yeah, Jeff.
Do I have to do something? I don't know.
Camera B is rolling. We're rolling.
Patients ask me all the time, what happens, doc, if I don't do anything? What I tell them is, you don't have to do anything. You can live with this. You can suffer with it. You can look at it. It's not going to kill you. You're not going to lose your leg. Nothing serious is likely to happen, but it will get worse over time. And complications do occur. And sometimes these complications are pretty unpleasant, and sometimes they're irreversible. Skin damage can occur over a long period of time, causing brown discoloration of the skin, which doesn't ever go away, down by the ankle, calf. Sometimes the skin becomes leathery and thick. We call that lipodermatosclerosis. It never goes away. A lot of these patients have pain and itching related to that. It doesn't go away. I've seen patients who come in with bleeding pains, and they're terrified. It usually happens when they get out of the shower, and there's blood all over the shower, and they're running to the emergency room. So these are treated. That's totally treatable. But if you leave it alone, those are the sorts of things that can happen. Probably the most serious complication of untreated varicose veins is an ulcer, which usually occurs down by the ankle. And they can last for months and months. I've seen patients with venous ulcers for years without healing. And many of them, they'll get them to heal, but they come back. And they live with this for years. And it's a shame, because if they had their veins treated, the ulcer would heal and it wouldn't come back. But it could be delayed, and you could treat it later, but you're going to need more treatment 5 years from now than you need now.
Nice.
Oh, I should probably talk about stockings.
Yes.
Okay. We always discuss with patients the opportunity to treat their problem with what we call conservative measures. All patients should try this first. That pretty much involves mostly compression stockings is the most important part. Compression stockings compress the varicose veins, it prevents swelling, it can reduce pain. It does make the problem better in terms of less symptoms. But you gotta wear the stockings every day for the rest of your life. Most patients find that to be pretty intolerable. In the warm months, people don't tolerate it at all. When you take the stockings off, the veins are still there. But that is a treatment option that we do recommend people try first. Other things that people can do is to avoid standing for a prolonged period of time, elevating their legs when they're sitting for a prolonged period of time, exercise, weight loss, all the things we know are good for us. These are things that can be done if you don't want to have treatment.
Sorry, we have to cut.
Sorry.
Goddamn pigs. Hey, we're paying. Well, you're paying them.
Yeah, they work for me. What were we talking about? Stockings, right?
Stockings, yes.
Yeah, so I'll reword all that, see if just try to do it.
What percentage of your people do decide to go with the stockings first?
Forever, or it's first?
First.
Well, pretty much all of them if they want insurance to cover.
Mhm.
But on a permanent basis, 1%. We put them
Okay.
to it because that's how insurance covers it.
It's not-
Should I say that? Yeah, I
Can I?
can say the insurance.
But yeah,
Yeah.
if yeah.
Let me try it and see if it
Okay.
works. We always tell our patients with varicose veins and other related conditions that an option exists to just treat the problem conservatively, without procedures. The mainstay of that treatment are compression stockings. Typically, they go from the foot to the thigh. They're pretty tight. They have to be obtained with a prescription. They have to be sized properly. And you gotta wear them every day, all day, for the rest of your life. For some patients, it will reduce the pain and the swelling and some of the other associated symptoms by compressing the veins, reducing the swelling. Most people, though, find that to be pretty hard to tolerate in the warmer months. My more elderly patients find them very difficult to put on in the first place because it takes some strength. Other measures are avoiding prolonged standing, elevating your legs when you're sitting for a long time, losing weight, exercise, sort of common sense things. We do recommend that for all patients before more aggressive treatment we do recommend that for all our patients before we do more definitive therapy. One, in case they prefer that route. And secondly, most insurance companies require that the patients try that first.
That's perfect. Perfect end to that. Would you like a drink?
I do. Yes, I think I got a little water left.
Okay.
Oh, I've got a question. Yeah, as people get older, they get up into their 80s, and you know they're more likely to have vein issues. I'm sure. I mean, is that something they should still engage in,
Good
or
question.
do people?
Yeah, I treat 90-year-olds.
Tell me about it. Let's see what the question would be. Is there an age limit?
Yeah.
So as people get older,
Yeah. One of the things about vein disease that is clear is that people from all age groups can suffer from it. We see people as young as teenagers, we see people as old as 90, and the whole spectrum in between. The most common range is in the 40 to 60 range, but we see them in all age groups. We see patients in their 80s every week. We've seen some patients in their early 90s. And they're very symptomatic. They have a lot of pain, they have a lot of swelling. A lot of them have other medical conditions, but the beauty of the treatments here is that those medical conditions don't really affect our treatment in any way. Obviously, we're more conservative in people who are in their late 80s and early 90s, but we've treated many patients in that age group successfully, and patients walk out and walk back in and they feel much, much better. The complication rates from the treatments we do are so low, and the tolerance for the treatments is so high, that there really isn't an age group that couldn't undergo treatment.
Great. Cool. Okay, I'm just trying for the sum up thing. So
I'm gonna look at your list and see if there's any others that I want to talk about. What other-
okay, yeah, I had, why are you a vein surgeon? What makes your staff different? What do you need to know about vein issues? What procedures do you
what
perform and why?
Yeah, so we didn't talk about that.
Okay,
We should talk about that.
let's do that first.
Okay.
But tell me about the procedures you do here.
The treatments that we offer here for vein problems basically fall into three categories. The common theme is they either close or remove the veins. These are veins that you didn't need them when they were normal, and you definitely don't need them when they're flowing backwards. So you either close them or you take them out. We do all of this in the office. Which ones we do in a particular patient depends on that patient's exact problem, and that's how we make a treatment plan. The majority of patients start with what we call an endovenous laser ablation for the saphenous veins, which is the most common scenario that we see. That's a procedure that takes about 20 minutes. It's a local anesthetic. You don't have to be fasting. You don't have to stop your medications. You can drive here yourself. You can drive home after. Our patients are in the office for about 40 minutes. It's a local anesthetic. It's a few needles to numb the vein. We put a little pinhole in the skin and put a laser fiber through that hole into the vein and thread it up. It's totally painless. A few needles to numb the vein that patients do feel. And then we turn the laser on and pull the laser out through the vein. And the laser basically fries it, closes it. It's painless. 20 minutes later, they're done. Put a dressing on, put their stocking on. They walk out, get in the car. There's some pain and bruising after for about 2 weeks. Take Advil, and then it goes away. The second treatment we do is what we call ambulatory phlebectomy. There are bulging veins on the surface that are very tortuous. They branch, they network, and they're complicated, and they're not the sort of veins that you can put a laser into. We like to remove those with this procedure called phlebectomy. It's not a stripping. Stripping is when the saphenous vein is pulled out. That's very invasive. These veins are right near the surface of the skin. So we just numb the skin with a local anesthetic, and we make a series of needle punctures. There's no incisions made. We have a little surgical hook that goes through there. We grab the veins, and we pull them out. It's painless, and you pull it out through the skin. Afterwards, there's a few marks on the skin, which gradually heal. Put a stocking on, patient walks out. There's almost no pain after, and it's very, very safe. And it's a great way to get rid of the bulging veins on the surface. The third treatment we do is sclerotherapy, which most people are familiar with. These are injection treatments. And we can inject big bulging veins, then we can inject tiny little spider veins. Any vein can be injected with sclerotherapy. The medication we use, the strength of the medication, will vary depending on the size of the vein, but they all do the same thing. A chemical is injected into the vein, and it destroys the lining of the vein. The vein closes instantly, and because you've destroyed the inside lining of the vein, it can't regenerate itself, and it gradually shrinks up and disappears. And with those three treatments, you take care of anything.
Nice. Well, nicely done.
Excellent.
Think?
All right?
Excellent.
Yeah, that was great. You took that, the whole big story, and just
Yeah.
put it very nicely.
I'm making it all up as I go.
Hey.
You're a good storyteller. Okay, yeah, let me try this one now, and then maybe we can try some more later. The idea of, okay, so, after all this, okay, I've got a vein thing that I don't know if it's bad, I don't know if it's good. What should I do?
Right. Okay. Okay.
1 second. Rolling.
So, many
What should I
patients-
do?
yeah.
What should I do? I don't know what to do.
Many patients know they have a vein problem. They know there are treatments, but they're not sure where to go. They're not sure what to do. And my advice to them is to do some research and find in your community an experienced, dedicated vein doctor. I would recommend somebody that does only veins. They're going to do it better. They're going to have it more streamlined. And your experience will probably be better. Call up, make an appointment for a consultation. We offer consultations that are free. We offer consultations that are free of charge as a way of encouraging patients to get through that hurdle. Not take any risks, just come in, see us, we'll tell them what they have, tell them what their treatment options are, and then they can decide. And it doesn't cost them anything.
Just say that one line over again, please, because there's a lot of traffic. Same line.
Which line?
We offer we offer free consultations,
Oh, okay.
or
Okay.
initial free
Right,
consultations.
right. We offer free initial consultations, and we do this as a way to encourage patients to take that first step and see us, because that's the first step. If you don't see a vein doctor, you're not going to treat your veins. So those patients will come in, there's no charge. We do a full evaluation, minus, let me say full evaluation.
Yeah. And I think the idea was that you want to come in, it's not that they're going to know about treating their veins, they're going to know what their situation is, right?
Right,
So,
right.
and then they can decide from there.
Right, okay. We offer our patients the option of a free consultation. That allows them to come in at no risk, at no cost to them, and they can learn from us what they have, what causes it, and what they can do about it. Then they're empowered to make decisions on what they want done. How's that? No?
It's, I want it to sound easier. You know, that,
Right.
And you're also saying that you offer this to your patients. These are not your patients yet.
Right.
You're offering
Right.
this.
yeah, it's kind of
Right.
like.
You're offering
you know,
this so people can understand what they can understand how to deal with their fears. They have these issues, and obviously their concerns. So you're trying to
Yeah, I
give
like-
them a definition as to what they're dealing with. What
Yeah, I think the key is that it's not an investment, you know, if you've got a question, don't wait. You know, there's no
Right.
reason you shouldn't find out because it's not going to cost you anything.
Well, the thing is that this is one of the things that a lot of the copies you guys have sent me make it sound like all vein doctors offer free consultations. That's not true.
That's not
No.
good.
We
Okay.
do, but not everybody does. So it's not like, you know, that's why I edited a lot of that copy, because it's not like all vein doctors offer free consults. I mean, it's
Mhm.
it's a doctor. They don't usually give stuff away.
Yeah.
Okay, so I say that we offer it because it's not. So I can't say go find a vein doctor, doesn't cost you anything. That's
Okay.
not accurate.
Well, then start out by
Okay,
saying
go-
you're going to see a vein doctor. We do it, so you know.
And we offer it for no charge, so that you can come in.
There's no reason not to.
So there's no reason not to. Right.
you're
You can just
removing
find
barriers.
out, and then you can go from there.
Right.
It's
right.
like,
Okay. Let me try it again. Ready?
so what should I do?
Oh, we're going back to that one.
Yeah,
Okay.
let's start there.
Once you've decided that you want to do something about your veins, no, not you, patients, right? Not just you. Once
Well,
a
and
person, once a
I
person,
think it's starting out if you have a vein issue. I mean,
All right, okay,
you
right.
haven't decided you're going to do
Right,
anything about
okay,
it yet.
Right, okay. If you have a vein issue and you want to learn more about it, you have to see a vein doctor. Find a good, dedicated vein doctor in your community. Call and make an appointment. We offer that consultation for free. You come in, you get seen, we tell you what you have, we answer your questions, we give you some reading material, and you're on your way.
There's no reason not to.
Okay, I'll add that on. There's no reason not to.
Cool.
They've got a lot of splicing to do.
So tell us your funniest vein story.
Two veins walk into a bar.
Trying to think about something fun.
I'm trying to see if I got everything. Why you need a specialist, yeah.
We didn't talk about what causes it.
Oh,
The
there you
anatomy,
go.
the physiology, you know, what it's all about.
Yeah, okay.
And the other question is don't I need these veins? It's a big question.
Okay.
Okay,
Good.
So yeah, we got to go into that.
We'll start running with-
Otherwise, we're talking about a condition without telling people what it is. Okay.
Okay, what's the cause of all these vein problems?
Well, the veins in our legs are responsible for returning the blood that comes down from your heart and returns that blood back from your legs, back to your heart. To do that, the blood has to flow up against gravity. Since we don't have a heart in our feet, there's not a lot of pressure driving it back up. So it has to walk up kind of slowly. And the way veins allow us to do that is they have valves in them, one-way valves. The one-way valves allow the blood to go up, it can't come back down, it gets pushed up, can't come back down, and it works its way back up. The cause of varicose veins and venous insufficiency and all of those related conditions is caused by failure of those valves. They don't close properly. If they don't close properly, the blood that's pushed up comes right back down. And so what happens is these veins start to basically flow backwards. And so instead of draining your leg, it's dumping blood back down. Now these are veins that are what we call superficial veins. There's two sets of veins in the leg. Superficial veins are in the skin, and even when they're functioning normally, they really don't do much because the skin doesn't get a lot of blood flow. There are veins deep in the leg, in the muscles of the leg. We call them the deep veins, which are the important ones. So these veins that become varicose are not very important to us, but we notice them when they stop working properly. And then that's when all the circulatory problems develop. What happens is the veins, when the valves fail, gravity pulls the blood back down. The back pressure causes a buildup of pressure in the veins down in the leg. They start to bulge like balloons, and you get varicose veins. And then the high pressure in the veins starts to leak out into the skin, and it causes the skin damage, and the discoloration, the ulcers, and all the problems that are developed.
Sounds good.
Yeah, I'm not crazy about it.
Is this an age issue? Is this a genetics issue? Is it a combination of both? Is it?
Varicose veins and venous insufficiency are extremely common. Somewhere between 20 and 50% of adults have some degree of venous disease. We don't really know what causes it. We know that it's valve leakage, but we don't know why the valves leak. We do know some of the risk factors for it. The biggest two risk factors are family history. There's certainly a genetic component to it. So if your parents or your siblings or your grandparents had varicose veins, you're more likely to have it. The other big risk factor is pregnancy, and especially multiple pregnancies. With pregnancy and with subsequent pregnancies, this problem typically develops and progresses. Other risk factors are typically occupations that require prolonged standing in one place. I see a lot of hairdressers. They're on their feet all day long. Being overweight probably contributes as well. And those are basically the risk factors.
With
I have something that.
okay.
I tell my patients that this is the one condition that you can inherit from your parents and your children.
Okay, do the whole thing.
Okay.
Set it up that it's
What,
hereditary
from
or
the beginning of that?
I'll just say, you can get
Okay, the risk factor part,
Yeah.
right? We know that varicose veins are caused by leaky valves in the skin veins, but we don't know what causes that. We know risk factors for it. The most common risk factors are family history, parents, siblings, grandparents. If they have this condition, your risk of developing it is higher. The other big risk factor is pregnancy. Women who become pregnant once, and particularly when they get pregnant twice or 3 times, big risk factor for developing varicose veins. I tell my patients that this is the one condition that you can inherit from your parents and your children.
that's great.
The other risk factors are standing in place for a long time in an occupation. I see a lot of hairdressers, for instance. They're standing on their feet all day long. Obesity, being overweight, probably contributes as well.
Great. This business has grown so much, that there are so many people doing, this procedure, this treatment, this service. Do you think that there's something going on that
We have to cut for a moment.
Oop.
This camera needs another battery.
Okay.
All right, so pose the questions when you think.
No, Is it just that now because there's an easier, better solution that it's so common, or are people getting more?
Camera 2 is rolling.
What makes a good or great vein doctor?
To be a great vein doctor takes a lot of different qualities. First and foremost, a good vein doctor has to understand the circulation. Vein disease is a circulatory problem. And I think that great vein doctors are doctors that come with a background in the circulation, be it vascular surgery or cardiology. A lot of doctors go into this from other fields. But I think coming to it with an understanding of circulation is an extremely important background.
I'm sorry, could you start that from
Yeah,
the
I'm
top
not
again,
crazy
please?
that way that came out.
Yeah.
I think I expanded too much on it.
Lucas, you're right there. Take a look at Jeff. Just want to check focus again.
Okay, Sparky, let's
Should I say
belt it
something
out
like,
there.
people ask me what makes a great, what, I mean, am I responding to a question? You're gonna,
Yeah.
this is your problem, you gotta
Yeah,
figure it out.
exactly. Well, we're gonna put a thing up first that says, so what's a great vein doctor?
Oh, okay, all right, I
Yeah.
see, I understand what you're doing, okay. You guys ready?
What makes a great vein doctor?
To be a great vein doctor takes a number of qualities. I think the first and most important quality is that a doctor who goes into vein work needs to have a really strong understanding of the circulation. Secondly,
I'm sorry, you said of the circulation. Maybe it should be of the circulatory system or of
Right.
circulation, not of the circulation.
Yes.
very good, man. No, you're right. No, you're right. That's what I said the first time. But let me just go run through what I'm going to say.
First one
'cause
is circulation.
It's hard when I'm winging it and then I go ums and ahs. So circulation,
The disease,
uh,
the technology?
circulation, venous circulation in particular.
Mhm.
An understanding of ultrasound imaging, which is a key part. Cardiologists do tons of ultrasound.
Mhm.
Skills at working inside blood vessels, which doesn't come easy. It could take many years to develop that. Hand-eye coordination.
Yeah.
I'm gonna forget this.
Here,
Should I write it down?
I'm gonna
I'm
do
gonna
it.
show
So
it to
number
you.
one is circulatory,
Circulatory system.
2 is
Venous system in particular.
Rolling. Sound. Rolling. Hit it.
boop.
What's they doing to you?
So what makes a great vein doctor?
Great vein doctors need a collection of qualities and skills. First off, they need to have a really deep understanding of the circulatory system. Then they need a deep understanding of veins in particular. They need to have a deep experience and skills of working inside blood vessels, small little blood vessels.
Can we go back to the beginning?
Yeah.
I think just fly through them.
Just
I
like,
would too, because you just,
Yeah.
you know, I need this, and then I need this, and I
okay,
need this.
okay.
You gotta do
Alright.
this, hands or whatever you say, and then love,
Yeah,
love.
okay. Great vein doctors need to know the circulatory system. They need to know the venous system in particular. They need experience working inside blood vessels. Scratch.
Okay.
Right. I'm trying to think
Is it-
how to
Yeah.
word the process.
Or what, instead of a great vein doctor, what are the what should you look for in a vein doctor? Is that a better way? somebody who has this and this and this and this.
Okay.
Is that a better way than, because I think,
So
what do you think?
So are you, well, you're gonna put that, in words, you're gonna say what makes a good, how do you pick a vein doctor? So I don't have to repeat that,
Or, yeah,
right?
yeah. Right.
Do you want me to say it?
If you say it and keep it as a separate piece, we can always remove it.
Yeah.
So, what am I saying?
Oh. Which?
There are several key factors to choosing.
I think I'd go,
What?
good vein doctors should have a strong understanding of the circulatory system.
I think it's good, it should be in the context of, there are a lot of people out there doing vein doctoring now.
Okay, that's good.
And what,
To
not
do-
just anybody can do this.
To do it well.
Yeah, to do,
Uh-huh.
but to do it well, you need certain qualities.
A lot of doctors are going into vein practices. But to do veins well requires a strong understanding of the circulatory system.
Mm-hmm,
Not just an understanding, it's experience.
mm-hmm.
Because understanding you get from a book. Experience. Solid experience in the working in the circulatory system. Or treating. So never just knowledge. Knowledge you can get from a book.
Working in the circulatory system is a good one. Yeah.
Working in the circulatory system.
But take that
The whole
take
circulatory
it-
system, start
take
out with
that
the
from
whole
the top.
circulatory systems.
But
And
then the veins.
then veins in
But you can't
particular.
say, no, maybe it's
No.
understanding. You need to have a solid
Background.
solid background. Okay. So what was the first sentence? Was lots of people are going into vein, but to do it well
You need.
requires a strong background in circulatory. Okay, all right. So let me try that. Okay, you were filming?
We're rolling.
Lots of doctors these days are going into vein practices, but to do it well requires a really strong background in the circulatory system, a really strong background in the vein system itself in particular. They need experience working inside blood vessels. They need to have real expertise in ultrasound imaging. And they need really good hand-eye coordination, because that's what it really comes down to. And they have to love their work.
Again,
Okay.
start from the top. And I'm just trying to figure if there's some way we could have more fun with the hand-eye coordination.
Yeah.
You could talk about your years as being a gamer.
Now you could say something like you need good hands, good eyes, and good hand-eye coordinate, and they need to coordinate. Something like that.
Good.
An exceptional hand-eye
Well,
coordination.
Well, or you could say you need great hand-eye coordination, because when you're working there, you're looking at the screen.
Right, but you don't want me to
And-
go into all that detail.
Yeah.
We're trying to make this short and pithy.
Yeah, that's true.
Well, we didn't say anything about good hands in this
Mhm.
list. You need to be coordinated. I mean, to put a needle in a tiny little vein takes very fine skills. So you need good hands. So we didn't. So that's part of it. I mean, you're not going to see a surgeon with bad hands.
Yeah.
Okay. So
But that's, I like that. You got to have good hands because you're working in very, defined, tight areas.
Yeah, so you need. So we're going to add that.
I think
You
you
need
can move back
ultrasounds.
slightly.
You need good hands.
You just move forward just ever so slightly. Good.
And then how do we get to the hand-eye coordination?
I do either hands or hand-eye. I wouldn't do both because it's getting too
Right.
long.
Okay.
Hold, please.
Which would you rather do, hands or
I
hand-eye?
would go hand-eye because everybody considers good hands.
Yeah.
It's a little bit of a more niche skill in just hands.
Yeah, well, or maybe you just go, and surprisingly, you really need good hand-eye coordination.
Well, that's a good one. Yeah, I
That's
like
okay.
that. I like that.
Uh-huh.
Okay, I like that.
Okay. So I hear there are a lot of people going into vein things.
Lots of doctors everywhere are going into vein practices these days, but they don't do it well. Lots of people are lots of doctors are opening. I'm sorry, I'm getting punched.
That's okay, this last one.
Lots of doctors are opening vein practices these days, but to do it well, they need to have a solid background in the circulatory system, in the venous system in particular. They need to be comfortable and experienced working inside blood vessels. They need strong skills in ultrasound imaging. And believe it or not, you need really strong hand-eye coordination. And it doesn't hurt to love the work.
I think that
Was it
nailed
good?
it. You nailed that one.
Did you smile when you said love the work?
I don't think so.
I don't think so.
I don't think so.
Oh.
I'm not going to edit in the smile.
I should do it again. I need
Yeah.
to smile.
Try it. Try
Yeah.
it. Try it. Try it. Hit it again.
Like you love the work.
Yeah.
But that was good.
Lots of doctors are going into vein practices these days. But to do it well, you need to have a strong background in the circulatory system, in the venous system in particular. They need a strong experience working inside the smallest of blood vessels. Is that going to be picked up?
Yeah.
Los Angeles, could that be Lori?
If it is, we're gonna tell her she ruined the whole shoot.
Right.
Really.
Oh no.
Okay. Lots of doctors these days are going into vein practices. But to do it well requires a strong background in the circulatory system, a strong knowledge of the venous system in particular. They need experience working inside the smallest of blood vessels. They need a strong background and skill in ultrasound imaging. And believe it or not, you need really good hand-eye coordination. And it doesn't hurt to love the work.
Nice.
Did
Yes.
that come out okay?
Is that nice?
I think so. I think so. Yeah. 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 I don't know if you said it doesn't hurt to love the work.
I didn't say that?
You did say
You
that.
said-
I don't know. I don't think you said that the first time around.
I thought I did.
Oh, you may have. You may have.
It doesn't hurt to love the work. Yeah. That's kind of nice.
It is. It's not
It's-
too.
it's-
It's not a hard sell.
Yeah.
Right.
Yeah.
As opposed to, and you gotta love the work.
Right.
So, was there anything else we felt the need for?